I try to explain to a patient prior to cutting off a cast that the saw that we're going to use is a vibratory saw, it's not a circular saw. Usually the saw is not going to cut the person, but it can burn the person. So we want to make sure that the blade is good and sharp and that the cast is dry. Trying to cut a wet cast will certainly gum up the saw and cause more problems. Most times we use an anterior posterior approach or a medial lateral approach. If the blade gets too hot, you can see that the patient can feel that, and they certainly need to let you know. But we go down through the cast to the cast padding. So that's why the layers of the cast are so important. So we're staying away from bony prominences, staying away from surgical areas, and any areas of tenderness here as we cut through the saw. I like to maintain pressure with my thumb and use a saw as a piston as it goes down. Then I'm going to take a pair of bandage scissors, making sure that they're good, blunt bandage scissors, and I'm going to cut the padding completely, making sure I completely cut the cast before allowing it to be removed. Never let the patient try to pry their arm out, because if they do, they could certainly displace the fracture and have